Hey, Miss Cullison. It's Ariana, now Pasquina, not Partis anymore. I got married like a week and a half ago, so fun fact. Um, so just like everyone else, final year of nursing school, and I'm very excited. Um, I'm really excited for this class because I love research and ultimately hope to go into research with my nursing career. I've kind of hit a road bump and don't really know what I want to do following school. I have two really big interests. Coming into nursing school, I was really big on doing oncology and wanted to go into like outpatient chemo type facilities and eventually become like chemo certified nurse and then become a nurse practitioner. And after a couple, maybe 10 years of being a nurse practitioner, go back, get my doctorate, and do like clinical trials and research on oncology patients with nutritional interventions. Because in the past of my previous degree, I kind of studied and looked into nutritional interventions in oncology patients, and I just fell in love with the concept and the holistic view of looking at how to improve quality of life rather than actually trying to cure the cancer, because a lot of cancer patients suffer from the side effects, and that's a huge interest of mine. But recently, I have discovered a big interest in wound care, and I also did a shift on the burn unit, which I really liked. I really like how autonomous it is, and the wound care nurse over at St. Mary's, her name's Sue, if you know her. She's totally awesome. She's literally offered to precept me, so I'm gonna see if we can make it happen. But yeah, so I just love how much autonomy she has, and she pretty much makes the calls for the patients. Like, it's not a doctor really overseeing her work. It's like her, making the calls of like, fixing this patient. So it's not like an x-ray, it's not like an MRI where you see progress. It's something you physically see getting better, and it's like you yourself that's making it better, not like a doctor, or like, it's not like something you just see from a test. Like, it's something you physically see, which I think is really cool about wound care. And yeah, so that's why I like that. But I think ultimately my hope is to have a lot of autonomy as a future nurse. And research is a big passion of mine. I've worked in a research lab, and I knew I loved it so much. It was research with animals and meat production, but because it was in my previous degree was in the College of Agriculture and Animal Sciences and stuff like that, because my degree was nutritional sciences, if you remember. But so I was working with a professor, and I just loved lab work and stuff. But I hope in the future I'd be doing more clinical trial type things, just because obviously with nursing I chose it because I'm a compassionate person. I like to be around people, I like to help people. So I think clinical trials would be more of my forte rather than being stuck in a lab. But I like both. I love research, and I'm so excited for this class.